long story since 2004.
2004 this started. So 2004, what did you do?
I was an electrician, and
Okay.
I remember I was pulling cable,
Okay.
wiring. So next day or the same day, I couldn't sleep from pain,
Okay.
and I start not be able to work because of heavy stuff on.
Okay.
And
So you got the belt, you got a lot of equipment,
everything.
and then you were doing something that.
But it started with me exactly 6 months before, and I was just, there's a cable on the ground. I was going to grab the cable,
Okay.
and I said on the floor. I couldn't. That was the first time in 2003.
2003.
But I didn't keep it in my mind. It was like one time, and that's it, and no pain after that.
So you went down, you were picking up a cable at work.
Every time I feel it's like somebody's holding 3 nerve and switching it.
I got it. Okay.
That's how I.
So that was the first time. Then nothing. You were good. What did you do?
I was in Saudi Arabia. I
Okay.
stayed in bed and just relaxing for 1 week. It takes me a long time. After that, I came here. I start working, and the problem start again.
Okay.
And it was daily basis.
So since 2004, you've been dealing. We're 14 years, guy.
And taking tons of oxycodone, of all this
A lot
kind
of pain meds.
Yeah, because nobody told. All of them, they told me there's no surgery.
Okay.
I sent my file to Paris, to American University of Beirut, to Texas, to New York. A lot of professors, they see to Cedar Sinai.
Okay.
And all of them, they told me there's no surgery for you, there's nothing you can do.
So why are you walking like this?
Because
What were you told?
They told me you have to keep continuing your life with this kind of pain, and nobody can do any surgery for you, because if you use
Since
surgery
2004.
for until now.
They told you there's no solution but pain management. Okay. And when was your last episode?
Last episode was on Wednesday. Last Wednesday.
Last week. And what happened? You
Just I have my foot on ottoman. I'm just moving the ottoman, and I fell on.
Before that, he sneezed.
Well, one time before that, I sneezed, and my father-in-law hold me. So because one time I was working in a parking lot,
excuse me.
and I fell down. The car's going back. I couldn't stop. My leg, well, wise, I did the test of the muscles. I have nothing, no problem with the nerves, nothing, muscles, nothing.
So you have muscle strength. You have no loss of muscle power.
Because of my back, not of my leg.
Okay.
I can use the muscles of my knees, but when it comes
You
to
are
my hip,
able to use it?
my knees never
Yes.
stop.
Ankles?
Ankle never stop.
Everything is in the hips.
Everything from here,
The thighs?
the thighs going all the way, and
To where?
on the normal pain, always here. When I sleep,
So this section here, from here to here.
Exactly.
Okay, but it doesn't go past your knee.
Yeah, it does. Yesterday, I have a shooting, but it's not every time different thing.
But the shooting goes past the knee or no?
No,
Okay.
stop here.
And
It used to be before, and I don't.
It
see
stops here?
Yeah, from the back.
But it doesn't go now into your toes?
No.
Okay, so you're already
Just-
giving us half the answer, okay?
Okay,
This is the good news.
that's it.
Okay, so now you've seen multiple people, multiple opinions.
I did the discogram test.
Okay.
It's one of the most painful surgery tests. I did the joint shot, SI joint shot. I did.
You've done cortisone shots?
I did 5 of them.
5
Five
cortisone
cortisone
shots.
shots.
Now we were taught you don't do more than 3. After 3 it starts to demineralize bone. So we need to address that as well and see. And I'll take a look at that for you, and there are some things we can do nutritionally. It's very simple.
And they did the spinal cord stimulating for me, and that was the worst thing I ever did in my life.
So
When they pulled the wire, they pulled my spirit with it.
Okay. It's okay. It'll be okay. I appreciate you coming out here.
Thank you.
I know it's a long drive.
Thank you.
Let's figure out what we need to do. Can we watch you walk, please? Do you need
Sure.
Do you need assistance to walk?
No, with this pain, I love it.
Come on up. And this is typical for him, right?
While I'm in pain, yes.
When you're in pain. Okay, can you walk a little bit back and forth, please?
Mhm.
Now, as you're walking, is it more pain when you step on your right heel or your left heel?
Today on my right, yesterday on my left.
Okay, come towards me, please.
Yeah.
So it switches from side to side.
Yeah, sometimes I walk like this, sometimes I switch.
So he's not the term is called antalgia,
Mhm.
meaning you lean away from pain.
Yeah.
But for, like right now, you're leaning
I'm
this
leaning
way.
this way. Yeah, I cannot.
But sometimes it goes the other way.
Yeah.
Do you get any numbness in your feet, tingle? Just shooting pain.
Shooting pain.
No numbness,
No
no
numbness.
tingling. You can go to the bathroom, okay?
Of course, not okay with the pain.
With pain, but
yeah.
you can go.
I can go, yes.
There's no bowel incontinence or...
But if I have, that's the only thing I notice. If I have constipation,
Yeah.
and I use the restroom, for example, let's say 2-day constipation, and I use the restroom, my pain go down.
So he's antalgic to the right at the moment. And you said when you're stepping with your right foot down?
Right now, the right foot, but I'm leaning this way.
That's what doesn't make sense.
Yeah, and the pain is here.
But you're leaning away
The
from...
pain is here.
You're leaning
yeah,
into the pain.
Exactly.
Why?
But if I straight shooting pain, I will start from here as well.
Aha, okay.
Yeah.
Got it. Come over here,
So I
please.
don't- sometimes I'm telling you, I don't know where I'm gonna go.
Okay.
Because I feel like circle of fires going around my waist. That's the right word to say.
The first thing I need to do is just visualize what's going on.
Mhm.
It's not too hot down here. So he's not like, it's not an acute, he's not inflamed in terms of the muscles and tissues around. But here's the first thing I want us to see, the dimples. They're completely different. So the pelvis is off here. You can see this one is higher, this one is lower. This one has more swelling though, compared to this. The question is it the sacrum? Now, you brought your MRI, we're looking at it. It says multiple herniations here. But multiple herniations, how do multiple herniations happen? He had to have multiple injuries, if it's true, okay? Now, if I push here versus there, that's the sacrum. So this is the sacrum, okay?
Mhm.
Now, this is 5. Is that tender when I push? Pain?
Pain maybe from your finger, not pain.
Nothing shooting, right?
Not shooting. Yeah.
Right there.
Yeah. Kind of. Oh yeah.
Now come back slowly, watch.
Mhm.
Right there. That's S2.
And still, it's not all the way. That's not everything.
Okay, sit up. Now, as I said, there's going to be 2 components here we need to figure out, right? Is the foundation, but also we need to check up top. Because a lot of times, sometimes if the messages aren't coming from the top down, then what happens? It's not going down. And the reason I'm explaining this, I was this patient 6 years ago. I had right shooting pain. I couldn't work for a month and a half. Tried everything. No one could figure me out. I had to go see one of my mentors in a different state. He found a 3rd cervical. He adjusted this only for a week. I still had pain. He goes, first you fix this, then you fix this. And after that happened, I got 50 cases like that. C3, all coming from here. I'm not saying it is or it isn't, but who knows? I gotta be careful what I say, guys. Left side, almost 15 to 20 points around C2, C3. You see that, madam?
Yeah.
Right
Oh,
there.
wow.
So there's a big reading up top here in the neck, sir. Now watch this. Look how the needle sticks all the way down. Do you see that, madam?
Yes, I do.
Can you tell your husband?
It stays all the way to 10
This
or
is
15.
this is cord pressure, upper cervical. I've explained this in,
Yes.
in the videos
Yes,
as
you
well. It's all starting up here. So I'm not gonna get anything here until I fix this.
Okay.
Okay, so we're gonna focus right now here. Okay, sir? We're gonna get this sorted out, and then I'm gonna check everything. Open wide and close. There you go. Do the right side only. Do the right knee only. Do the left side. Left side only. They're both stuck. Do the right side. Okay. Do the right side. Do the left side. It's up there, and that's 2. This is 7, 6, 5, 4. That's 3. That's 2. Head down. Turn left. Turn right. Look straight. Look up. Turn left. Turn right. Look down. 7, 6, 5, 3, 2, 1. Okay. Let's go ahead and motion the head up. Left. What I'm motioning here is the occiput, the skull, okay? This is moving fine. It's a little tight on that left side. So what I'm finding here is actually starting at his 3rd cervical, C3. Now, I'm gonna dig in a little bit more than normal, okay? Just to, good. Okay, do one thing. I'm gonna just put my finger here. Stand up for me, please. Stand up and sit down. Okay. Stand up and sit down. Let's go ahead and set your 3rd cervical first. Come up slowly, please. You okay? Okay. And now just walk. And the purpose of that is now we got to rescope and make sure. Now let's see what actually shows up, okay? You okay, sir?
Yeah. I'm totally okay.
Have a seat. So now, let's see what happened. It's different now, right?
Yeah.
Okay, now let's see what we find. There it is. It's down low, sir. 5 is here. Okay? It's not 5. It's down low, dude. Right there. Now when I push, tell me if it's different. There versus there. Right there. That's the one.
This one, the one on the lower, it's more hitting the right side. I feel the pain more.
Okay.
And the one on the top is linked to the left.
Okay, good. No,
I guess that's how I feel it. I don't know if I'm saying something right or not.
You are. Okay, so let's go back to 5. 5 is an issue, but it's not starting at 5. Let's go to 1. S1. Okay, let's go to S2. Okay, let's go to S3. Where is it starting?
No, two should.
S2.
Two stronger pain than S3.
Okay, so we need to start on S2. That's what I wanted to show you, okay? It's starting in the sacrum. It's not starting in L5. I'm going to do it as an S2, push, pull. Go ahead and just hold your wrist there, please. Let me push your shoulder up. Are you okay with that? Good. We're going to do this 2 parts. First part is to get that S2 set here, and then the second part is going to be, there it is, good. Gotcha. Now before you stand, I want you to sit right here and just do this.
For blood circulation.
Now use your knees and push up. And let's walk. You got up a little bit easier, a little bit. Now, it's not to say the other stuff isn't there, the 4 and 5,
Yeah.
but it's not starting there.
It's not starting.
We have to stabilize first the pelvis and the sacrum. Okay, keep walking.
Now, as I'm walking right now,
Yeah.
exactly, the pain is walking with me, this point and this point.
Now, as you're walking right now, what's different? Good or bad, it doesn't matter, but what's different? No change yet?
No change.
No problem. Come on back over here and have a seat. So, I want you to see one thing right away. Here, it's less swollen, right?
Oh,
Yeah. Head down, head down. Still about 5 points. Clearer there. Now let's see what happened here. And either you're gonna love me or hate me after this. Okay, let's go back. S2, S1, tell me, S2, S1,
Can I tell you where's my pain going?
L5, now, tell me,
There's a nerve not on the 5. When I'm moving, nerve shooting.
when I push 5,
No, before 5.
that's 1, okay.
The 2, I guess. Yeah.
Okay, let's go on the orange table.
All right.
Okay. There you go. Head down, please. I'm just going to pump it a few times just to prep it. Can you handle this here? Is anything shooting down your leg when I do this? Gotcha. That's what we need. Okay, sir.
I'm breathing. As long as I'm breathing, I'm good.
I got you. That was a home run, dude.
Trust me, for him it was.
That was a
It was a
home
big
run.
step for him. Yeah.
You heard that, you felt that one, right?
Of course.
Take your time. Give me your hand. Look up. Step to the side. And walk. You gotta walk it off now. Keep your head up, please.
My head?
Look straight, I mean. Look straight.
Yeah.
Don't look down. Beautiful.
Straight.
You're straighter.
I can feel.
Walk.
Yeah, I can
There
feel.
you walk. I had to go for it. Look, he's getting better as he walks.
No, I'm telling you right away. I can feel it.
Keep walking.
But the only thing is the pain from.
Oh, that?
Here's something now it's loose. Before it's not. Am I right?
Why are the ladies laughing at you? Your wife is laughing. Why is she laughing at
Well,
you?
let her laugh.
Let her laugh.
She's being suffering since 2004. so at least if she can laugh, let her
Get a
laugh.
smile from her, dude. Now you're gonna see each time is gonna get less. You walk now.
If she can laugh, let her laugh. She cry enough, trust me.
I'm sure. And your children. You're gonna be okay, dude. You're walking smoother now.
I never.
Now, here's the thing we need to understand also. You look at this as you had this big rock on your foot. I got to get the rock off the foot, and now it can heal. Does that make sense?
Yeah.
But it was misleading. You had a lot going on up here first. Now, when you get your, we're working off those MRIs. That's what we did. You'll get your full spine. And we got to do the pelvic analysis, and then we'll do the analysis and figure out what do we need to do to fix this. Okay, the best we can. And we need to look at the condition of the disc. You
I
keep
want to
walking.
mention something. For the past 15 years, not one person said it might be from your neck.
Say that again.
No,
No,
in the past 15 years,
even
nobody's
depends.
ever said his neck.
But no, but that's not a common thing. So you can't. I don't want to say anything against anybody else. And the only reason I know this, I was the patient, and it was one of my mentors. Been doing this 40 years. Sit and stand a few times now. It should be easier. Stand up right away. It's not 100%.
No. Totally understand.
Have a seat. Push off your knees. Now walk.
I can say one thing, that after the honeymoon we didn't enjoy
Because of this?
our age, right? Because of course.
Well, guess what? She gets her honeymoon. So as soon as I fix you up, guess what?
Going back to Puerto Vallarta.
Yeah, with the 4 kids, of course.
Yeah, now it's quiet.
In the middle, yeah.
Yeah, it's quiet now. Now watch this. Let's see. Back slowly. I know.
It's more flexible,
Yes.
and I
but
can
it's
feel
tender.
it. I can feel the joint.
Yes.
I
you
guess
can also
because
see.
before you were pressuring on one piece.
Yes.
Now I can feel that there is 2 pieces.
It's moving. So here's S2. Okay. Here's S1. And here's L5.
Yeah.
It's still going to be a little tender. That's where we're going to start, okay?
Okay.
Stand up. I want to check something else, please. Put your hands on top of mine. Raise your right leg. Look at me, please. How's the back pain? How's the back pain?
No, but
Other leg. Okay. Is it hurting where you're lifting?
it's hurting on the, it's going shooting
Okay.
left and down, but the right one.
So
Which is
it's a good test for us as well. Okay, you go get films and we'll see you tomorrow. Day 2, and you were pretty sore after our first adjustment, and that's okay.
Well, yes,
Yeah. Now, we worked on your low back. That's what you came for originally.
absolutely.
But you said you had trouble sleeping because of the neck pain.
Yeah, only yesterday.
Okay. Well, you want some good news? There's only 5 points today
That's good.
in the neck. Now, and here's the idea, right? We're getting pressure off the nerves. The body has to find its new happy place,
Absolutely.
for lack of better terminology. Remember we had cord pressure yesterday? We don't have any cord pressure today. We have 5 points up top. And 10 points on the bottom. Not bad with one adjustment. So today I'm getting here and I'm getting up here. The swelling has gone significantly. You can see the dimples better. You can see this one is lower. And on the ASEX, the EX is what's causing that down. The one thing we're going to try to figure out is it's also possible that from whatever injury he had early on, even before that one, I'm talking back in like high school or elementary, he could have had a fall here that malformed this. So we're going to be, as we're working on the sacrum, I'm going to be torquing it to lift it up a little bit, okay? Make sense? No, but
Make a
you're
lot of sense.
Oh yeah. Oh yeah. We're gonna do the left pelvis. we're gonna do L5 here, and we're gonna do I'm gonna save the neck. I'm gonna save it this time and see what happens, okay? I got you.
Yeah.
Don't worry.
I'm on you.
Alright, ASEX, so we gotta bring it down and torque in. Home run. That was easy. Walk it off. Look at his dimples when he walks back. You see how fast he got up? Not too, right? Where's your cane, dude? You had a cane yesterday.
I know.
What happened to your cane?
We left it at home.
Habibi, where's your cane, Habibi?
It has another use, but not right now. I'm gonna tell you when I finish.
It's in the car for emergency, right? So let's make sure you're nice and relaxed. Tummy down. Tummy up. Tummy down. Bring your chin up. Chin up. There you go. Tummy down. Got it. Gotcha. Okay. That wasn't so bad.
Not that much.
Not so bad. Come up slowly, please. Look, he's getting up all by himself. It's good. Walk. Hey. You okay? Tell me. Tell me what's up. Walk. Keep walking.
Just want to complain or not?
You can complain. It's okay.
I don't want to complain. If there's
It's
no
okay.
complaint, don't complain.
Have a seat. Shoulder up. That's the rest. Perfect. Okay, walk it up. So if you watch his dimples, they're actually now moving together. They're actually moving.
You remember when I used to tell you, when I stand up in the mirror, I always tell you this side it's higher than this
Yeah.
side. Even if I'm not
Yeah.
walking, always
can
they
feel
told
it.
her, I thought, why this side always up and this
Yeah.
one? I can see it, it's not even, especially when it gets swallowed, like
Okay.
when I have the major pain.
Yeah.
The question is, what happened?
What happened?
What really happened?
Okay. 3 major car accidents.
Which you
One of
failed
them-
to tell me about the first day.
Yeah. I hate to remember it, to be honest.
How about this one?
Ah.
How about this? Okay.
Good job.
Still some more. Orange table, back to your favorite.
Yesterday, I left here and I went to downtown
Okay.
to work. So my neighbor, how are you feeling this and that? I'm having next month surgery for my neck. I told him no. wait, don't do it. I swear to God, I told him don't do it. So what do you mean? I said, no,
Yeah,
don't do it.
too.
Wait for me, be patient. I send them right away the website, I send them the video,
You're
to watch it. But don't do anything before you ask me. I said, okay, I'm not gonna.
I appreciate it.
Nice catch, though.
Still smiling.
I know.
That was the home run. Those others were base hits. That was it. It happened. You see what he did? Yeah. Okay. Good. Good. Have a seat, sir. All right. Colors. Colors.
Still on top 5.
Still a little bit here. There. Gotcha. Shoulders. Look straight. There you go. Look straight ahead. There you go. Now you get a buff and polish.
the heat thing?
This breaks up scar tissue.
You're getting brand new husband, wait.
You keeping it? Okay.
He's
We're
a
making
keeper.
sure.
He's a keeper.
You have options. You're in America, you know that.
If she wanna do it, she will do it 14 years ago, not right now. After 14 years of suffering, right now she wanna decide.
He's like, no, you're gonna get better and then it's payback.
Give me 5 years, ask her this question after 5 years, she will tell you what this is.
It's payback. Squeeze, hard, squeeze.
Oh.
Nice, squeeze. Tiny bit on the elbow here, that's it. That's it. I'll leave it here.
It's all yours.
I know. Squeeze. There you go. Squeeze. This one's solid. This one's good. Let me one more time. Squeeze hard. It's better, but it's still.
But there is a weakness, I can see it if I'm tighten.
Now try. Squeeze. Why are you looking away? It's better.
I'm gonna look here. Oh yeah, way better.
All right, you're all set for today, my friend.